brain chemistry, as we all know, plays a role here, and it begins to elaborate over time, correct?
Correct.
Can you talk to us a little bit about that?
Well, when the patients come into the office, we screen the patients. We ask them, are you feeling hopeless, helpless? Do you have a lack of interest in doing things?
Correct.
When they answer yes to one of those questions, we do the PHQ-9s. And
Correct.
typically we ask them, like, how long have you been feeling this way?
Correct.
We start on a smaller scale,
Correct.
like 2 weeks, and then if
Exactly.
it's longer.
And the PHQ-9, and we'll get into that later, is a questionnaire, sort of a reproducible questionnaire, a tool that we can use. So we're going to go to a graphic if we can, and that graphic talks a little bit more about warning signs. So these are warning signs for suicide.
Yeah, and this is some of the typical signs that we will see with patients that are very depressed and then are expressing feelings of suicidal thoughts. They begin to feel hopeless, feeling trapped, and whether it's trapped with their thoughts or trapped in their situation or their environment, they feel alone and isolated. Anxiety is a big comorbidity along with depression, so generally patients will be having a lot of panic attacks or just a feeling of generalized anxiety. They feel hopeless, that there's no reason for them to go on with their current life. And they begin to think as the only way out of this is suicide. And you know, mood swings can go up and down, but generally there's this pervasive thought of, you know, I just can't make it through this any longer. Alcohol abuse and drug abuse also can coexist with many of these symptoms.